We've got a big problem with obesity in the UK. 1 in 5 children are already overweight or obese when they start school. And by the time children are leaving primary school age 11, we've got 1 in 3 of those children obese or overweight. And the problem continues into adulthood, and we have over 60% of adults who are overweight or obese. So clearly there's a need to look at the sources of calories in the diet, and one of the things that many people are consuming too much of is added sugar. And so that, I'm sure, is why the government has focused on sugar as one of the key areas to address in terms of tackling obesity. A lot of the work has been done with drinks, so it's relatively easy to take the sugar out of a drink and replace it with a low-calorie sweetener in order to retain the sweetness that some people want, but without the calories. So a lot of work's been done on that. It's relatively straightforward, and we've seen big reductions or shifts in the proportion of low-calorie drinks on the market versus the standard high sugar versions. It's much more difficult to do that in some foods. So we've seen progress. The Public Health England's sugar reduction programme, Year 1 data, was published earlier this year, and it demonstrated that some categories of foods have already achieved the reduction. In the first year, the 5% target has been achieved. But it is more difficult to replace sugar in foods for a number of reasons. One is that the sugar is not just providing sweetness, it's providing bulk, it's providing mouthfeel, and that is difficult to simulate with another component. If you take the sugar out, you've got to, in many cases, put something back in, which might also provide calories, and so you're not necessarily reducing the calories. You might actually be increasing the calories depending on what you choose to put in instead. There are also some regulatory hurdles. So for products to include low-calorie sweeteners, there has to be a 30% reduction in the sugar and the energy content compared with standard products. And sometimes that is too big a jump to do in one step, and so that in itself is a hurdle. So there are a number of different ways that sugar can be reduced. One is around portion size, for example, reformulation. Part of that is using low-calorie sweeteners to replace some or all of the sugar. And there are some technical hurdles around that. But there are also consumer perception issues that we need to challenge and help people make more informed choices, I think, help them understand what the science is actually saying. So I think one concern is perhaps around the safety of them, and I think there has been a huge amount of toxicological testing going on, and so we can assume that they are safe. This is kept under constant review, but the current evidence is that they are absolutely safe in the levels in which they're being consumed. But I think there is a job to be done to help people understand what the evidence, the actual evidence, is saying, rather than some of the myths and misunderstandings that are perpetuating in the media. We see conflicting stories every day in the newspapers about this, and it's really not helping people who have got lots of things to consider in their lives. We can't expect them to be experts on everything, and I think we need to give them, the public and also healthcare professionals, a guiding hand in understanding what a reliable digest of the evidence is.